Very good morning to you once again if you're just joining us. Well, South Africa today starts rolling out the COVID-19 vaccination program, which will begin with healthcare workers. Now, the first batch of 80,000 Johnson & Johnson COVID-19 vaccines arrived in the country yesterday. Questions are being asked about the efficacy of the various COVID-19 vaccines, and joining us now to tell us about the process of the vaccine rollout is Professor Adrian Puren, head of the Center for HIV and STIs at the NICD. Prof, a very good morning to you. Health workers get to be the first to be vaccinated. There were concerns, they raised concerns, in fact, I should say, much earlier when we heard that South Africa was going to receive this vaccine as opposed to the AstraZeneca, which is already in the country. And it's all got to do with the effectiveness of this vaccine, Prof. So let's start with mild to moderate symptoms. How is this Johnson & Johnson vaccine measured? And then, of course, the all-important prevention against hospitalization and deaths.
Yeah, so that's a really critical discussion. I think that the overall effectiveness of this particular vaccine varied by country, from about 70% right down to about 50 or 67%, depending on which country was looked at. But if you look at the limit of effectiveness that the WHO has set, this particular vaccine, Johnson & Johnson, overall does meet the criteria for both effectiveness as well as safety.
Yeah,
I think that it is important, and I think the critical component here around the Johnson & Johnson is that it's a single-shot vaccine, and in terms of its cold chain requirements, these are very different as well. I think you still need a 2 degree. It's likely that you will still require a 2 degree cold chain, but in fact, compared to the so-called mRNA virus vaccines, that's very different. So I think that there are certainly advantages. And one of the additional advantages of this particular vaccine compared to the problems that we've seen with other viruses, vaccines, is that in fact it protects highly against poorer outcomes, in other words, in terms of hospitalizations and poor outcomes. So I think there are some really good advantages of this particular vaccine.
Yeah, also critically important, Professor Puren, is the variant that has emerged here, the 501Y.V2. How effective is the Johnson & Johnson vaccine against the variant?
So it is effective, but the overall efficacy is about, I think, 57%. But as I said, that still means that it's a working vaccine.
Yeah.
I know it's not as high as the Moderna or the Pfizer, which reached about 95%. But given that the cutoff or the acceptability was about 50%, that means this is still a working vaccine, and I think it should be used and utilized.
Sure. Prof, we can't overlook what clearly appears to be a dramatically different process from what we saw when the Oxford AstraZeneca vaccine arrived in the country. It went into quarantine for some 10 days, and this was now before the discovery that first it was going to expire at the end of April, and then also that it was not going to be as effective against the variant. Now the Johnson & Johnson arrives and there is no control or quality check. There is no quarantine, basically, of this vaccine. It's simply going to be rolled out ASAP. The workers have been concerned. Are they going to be guinea pigs? It's a question that I have been asking since the news that this was going to arrive in the country.
Yeah, so again, I'm not affair with all the minutiae around the regulations around this. I think SAPRA would be the best place because, they are the regulators. I understand that they have been collecting data on a continuous basis. And so they may well have, because it was part of a trial, so it's under emergency use. So I think what we need to understand from, just to allay all the concerns, is really to understand from a SAPRA's perspective, how the vaccine has been monitored in terms of its utilization. Because remember, the trial was only recently stopped, so there may well be levels of control that were already in place. We need to make sure that those have been confirmed compared to a vaccine like the AstraZeneca, which may well have had to be produced and then come through initial checks.
Yeah.
So I think you're quite right. A laying of concerns is very important so that we can have trust. And so I think it'd be worth the while exploring with SAPRA, what the regulatory events are around this particular vaccine to ensure its utilization. My sense is if they have allowed the utilization, they would have gone through their particular checklist to make sure that the vaccine they have released for use meets the requirements around safety, because that's their first duty, is the safety of the citizens of South Africa.
Yeah, the other element to our conversation, Prof, is that of long-term protection. So once these health workers have received the jab and there they are treating and handling patients who are suffering with COVID-19, are they completely immune from contracting this virus? And yeah, I guess that's the question.
A very important question, and it applies to all vaccines, because again, we've gone through this particular phase where vaccines have been approved, but the next critical part is you're quite right. Yeah. So we have efficacies of, let's say, 57% or 67%. That means that there will be people that are vulnerable. So you may well receive a vaccine and it may not be effective. So currently within South Africa, are mechanisms being put in place to ensure that those individuals who do receive the vaccine are monitored in terms of if, for example, person X has been vaccinated, now ends up in hospital, is it because of COVID? And if it is because of COVID, has this particular individual been vaccinated? So there are mechanisms, in other words, to really ensure that these vaccines are effective, and monitoring, because again, real world versus trial conditions are very different. So it will really be critical to ensure that individuals who end up in hospital who have been vaccinated are monitored to understand and to provide information as to why or how this particular vaccine has not worked in this particular individual. So those are critical elements with regard to vaccine surveillance.
Yeah, and linked to that very question, Professor, the South African government, the health department, and the whole value chain, the wonder here is, at which point would they determine that the population, all citizens of the country, are now comforted that these vaccines are working, but most importantly, they are safe to be administered into human beings? At which point, in your view, do you think this will start being realized? Because right now, everyone is still reticent about this vaccine, and the population will be even more worried if it's health workers themselves who are raising questions about the safety of the vaccine.
You're quite right. So that first part is really trying to ensure the elements of trust. In other words, being transparent about what this vaccine can achieve and what it can't achieve, and what is still required. So I think that's going to be really critical. So as this particular program is rolled out, it's important that we ensure that, for example, this is going to be in the healthcare workers and who are really the individuals that is targeted, and we want to protect those individuals, because we've seen what has happened in this last resurgence, is that healthcare workers were fragile and vulnerable to this particular vaccine. So we really want to preserve our healthcare system. So it's that matter of trust. But then it's a matter of looking at what is the uptake of this particular vaccine and responses, and as well as the immune responses to this particular vaccine. The extent of the uptake, I think, will really be critical, as well as the effectiveness of this particular vaccine. So we've got the efficacy data, but now in this real world situation, how effective is it? And so the hospitalization rates or infections at hospital level will certainly really be critical to say, well, yes, this vaccine is really effective. It meets that 80 or 87% level that we've seen in our vaccine trial, and therefore we are really confident that this particular vaccine is working as predicted.
Yeah, final question to you, Prof. And unfortunately, I am going to have to put you on the spot. It's about the AstraZeneca vaccine. We heard yesterday the health minister saying, well, they have been offered to the African Union so that countries on the continent could benefit from them. The question around them, Prof, is that if they are not going to be effective for use in South Africa, why should they be effective for use in other countries who might well already also have the variants? I mean, this morning I read about Botswana, which also now has is experiencing its own variant of the COVID-19 vaccine. Is the AstraZeneca vaccine safe to use and effective to use?
Yes, you really have put me on the spot, and I think I haven't fully answered your question around the variant and the lineage. So I think in the context of South Africa, that was, as you saw from that small-scale trial that Professor Mahdi presented, the effectiveness really was not significant. I know the WHO, it's quite interesting, that they said regardless of what is in circulation, these vaccines should be used. But you have a point, and I think that, again, depending on the degree of molecular analysis that has been done in the various countries, if there's limited or no evidence of this particular variant or lineage in those particular countries, then I think one would advise utilizing this particular these particular vaccine doses so that they do not go to waste. As you know, in the UK, for example, this vaccine is being largely rolled out, as well as in other countries. So my sense is that, yes, you just need to take into account the context within which this country finds itself in, and whether or not that particular vaccine can be utilized. But also keeping in the back of your mind that, again, in terms of, because remember there were discussions around whether or not the AstraZeneca vaccine would actually protect against severe disease and hospitalization. So again, there may be a use for it, and I think South Africa is probably still exploring that. But you're quite right. I think the context within the country will be critical in terms of whether or not the vaccine can be used, and therefore be used in the African continent, depending on which country it's being looked at.
Yeah, Professor Adrian Puren, thank you very much, and apologies for putting you on the spot. He's with the National Institute of Communicable Diseases, and I wouldn't ask that question if you weren't capable of answering it, and there you are. You have put us into context around this issue.